here. And we're going to start with Hyobum Jang from the World Health Organization. And I'm really delighted because I know you have just presented now a new framework for countries to achieve an integrated continuum of long-term care. So thank you very much for presenting that to us. The floor is yours.
Thank you, Adelina. Thanks for inviting me to this event. And yes, Adelina mentioned the framework on long-term care from WHO has been just published. I'll be happy to share the link with you. And as we haven't expected this could be done with this in line with this event. We will be having some kind of different launch or dissemination events, but this is one of the first times we are sharing this completed framework outside WHO. So it's my pleasure, and I would like to provide a very brief overview of this framework and how that could be further related to your work on long-term care and possibly linking with the COVID-19's impact on long-term care. So let me share my screen. So the framework for countries to achieve an integrated continuum long-term care has been planned and designed over the last few years, and it has been just recently launched. I will provide a background of this work and the contents, brief contents, and what is the implication for us. So I don't think I need to mention in detail about the global aging situation, but the number of older persons will be growing significantly. And we notice that many of them will be living in low and middle-income countries. And it is very challenging for countries, especially in these countries, to set up long-term care systems in place, as they are still relying on a lot of informal care provided by family and informal care workers. So although there are many older people with this age group will need care and support from others, there will be not many people who will be able to meet their needs. From WHO, it has been years for us to advocate this concept of healthy aging. So over the life course and biological aging, we provide two trajectories of increased capacity and functional ability. So for the life course, even though someone has lost their increased capacity, both physical and mental, it is our idea for these older people could get support to maintain their functional ability and enjoy their healthy aging with dignity in their life. So long-term care should be provided at the later stage of when this capacity is significantly lost. I assume there has been already a lot of scientific and theoretical discussion on long-term care among these groups, but we also would like to tackle the common perception that long-term care is just limited to assist care or caregiving, but we would rather say long-term care should be provided in an integrated way over the continuum of care, starting from prevention, promotive services, and cover rehabilitation and palliative care. So an older person with significant loss of capacity should be receiving the person-centered services. So just to remind how WHO has been working on long-term care. Of course, there have been some variances among regions and countries, but at the global level, the WHO's work on long-term care has been active since WHO published the World Report on Aging Health in 2019. So in this report, long-term care has been identified as core elements in healthy aging. And recently, there has been some meaningful works on long-term care systems, and as well as some guidance on long-term care and long-term care facilities during COVID-19. And our colleagues in other regions and COVID Center has been also very active, producing a lot of technical products and leading LTC discussions. For global level, we are now under the UN Decade of Healthy Aging from this year to 2013. And long-term care is one of the 4 major action areas, as you are aware, that is providing older people who need it with access to long-term care. Under this UN decade, which WHO is doing a secretariat role and collaborating with the other UN agencies, we are responsible and mandate to provide technical guidance to countries for their national analysis of long-term care systems, as well as providing tools and guidance for implementing long-term care, supporting informal care workers, and linking with social care systems. So this WHO Integrated Continuum Long-Term Care Framework has been one of the first products under the UN decade that WHO has been focusing on at the global level. So the framework will support policymakers and system-level planners and decision makers to assess their system elements and evaluate their readiness and components for long-term care systems and services so that they can implement the services. Looking at our recent survey with the countries which has been incorporated in our baseline report on aging health for UN Decade of Healthy Aging, still not many countries have long-term care related policies or plans and strategies. You can see in the European region, most of countries would have long-term care policies and their reporting rate is very high. Although in other regions, WHO regions, not just reporting rate is low, but also we can see not many countries have long-term care related policies. And we don't actually know how much these policies are contextualized or implemented in practice, whether they have just long-term care related components in their laws and regulations, and it's not really in place yet, especially at community or primary healthcare level. So it's our challenge to identify those situations. One of the WHO surveys during COVID-19 gave us a hint how long-term care services has been disrupted. So among different essential health services, long-term care is one of the most heavily affected services. You can see total 35% of reported countries indicated that long-term care service has been disrupted. So what we learned from COVID-19 pandemic, which gives more implementation for this framework, we have seen the fragmentation of long-term care services within care systems, and there have been lack of legislation, rules, and qualified staff, and inadequate strategy and frameworks, and there is inappropriate regulation and quality of services. So this mandates us to strengthen intersectoral coordination, quality assurance, and health sector oversight. And in eventually long-term care services are integrated and provided alongside the traditional continuum care. So this is the main framework from this WHO long-term care framework. There are 6 core elements which you will see familiar given the existing WHO's health system building block approach, from governance, financing, workforce, service delivery, innovation, and information. For this long-term care framework, we value their core principles of integrated long-term care system. It should be person-centered, and it should optimize functionality over time, and should be provided in the community, not just with long-term care facilities. It should be provided integrated services, continuum care, and empower the people and emphasize support for carers and care workers. The framework is also providing a practical checklist that countries can start utilizing through checking 84 action points within the 6 core elements categories. So I will not go through the details of checklist, but you can find this checklist in the provided link. So when you see just a glimpse of this checklist, you can apply the rating and then see the overall picture of your long-term care systems in your country or subnational level. Under the decade, we have a long-term roadmap starting from this long-term care framework and providing the service package, which should be integrated in national universal health care programs, and we expand support for caregivers, especially informal carers like families, and then provide countries and different levels of long-term care administration people with implementing tools to long-term coordinate and integrate long-term care services. And for the long term, we are going to also understand more of the national level long-term care systems and would provide some global guidance and models of long-term care. For the next few years, this framework will be followed by the service package, as well as some implementing tools for long-term care systems and services. And of course, there should be country support throughout our WHO three-layer structure, which we will also rely upon your technical support from experts. And many of you are already in the global network long-term care, which is our external advisory group. We will convene meetings and working groups, and we hope to connect this impact of COVID-19 with strengthening long-term care in countries. Thank you very much.
Thank you very much, Hyobum. You will take the